One of the NCDR highlights of this meeting was an analysis of the effect of acute kidney injury on outcomes in patients with acute MI. For example, prolonged cardiopulmonary bypass is associated with high morbidity and mortality, and acute kidney injury is probably the most common complication after cardiac surgery with prolonged cardiopulmonary bypass. So let's talk about a late-breaking clinical trial here at AHA 15 in Orlando, and it's the prevention of renal injury by nitric oxide in prolonged cardiopulmonary bypass, the Nitric study. So to do this, I am talking to Dr. Chong Lei, who is an MD and a PhD from the Department of Anesthesiology at Xijing Hospital in Xi'an, China, and Dr. Lorenzo Berra, who is an MD at Massachusetts General Hospital, where he is a staff anesthesiologist and a member of the Anesthesia Center for Critical Care Research there. Now, let's talk about the science of prolonged cardiopulmonary bypass first, and then the hypothesis that's behind why you decided to target the problem this way. Let's start with you first. Dr. Berra?
Thank you so much for inviting us. So we really focus on cardiopulmonary bypass because we know that in the operating room where we work, we always see patients that they start to develop urine in blood in the urine, and they started to develop acute kidney injury after the cardiopulmonary bypass, especially those patients that they stay on the cardiopulmonary bypass for a prolonged period of time. So we started to look into that, and we knew that there was no prevention treatment for those patients. Dr. Lei Chong, who we worked together in the laboratory, we studied a little bit in an animal study how to prevent damage due to hemolysis to organs. And she found in an animal study that plasma hemoglobin, and therefore hemolysis, can cause kidney injury. Our hypothesis was that replacing nitric oxide in plasma to normal levels of nitric oxide would prevent nitric oxide.
Now, the patients that you're evaluating, it's interesting. You have a group of patients who you enrolled in this study that you have a specific problem in China, correct?
Yes, that's right, because in China, the prevalence of the rheumatic fever caused this kind of younger patient need to undergoing multiple valve replacement. That's why we chose this kind of patient, which is different from the Western countries.
So in this case, if you can just talk a little bit about, so you have a past history of rheumatic heart disease and a large number of young patients who need valve replacements. So now, how many patients did you enroll and what did you find?
So we enrolled 217 patients, and they were divided equally, 212 in one group and 105 in the second group. In a group, the control group, that had received only mixture of air, and in the group that was the treatment group, we delivered 80 parts per million of nitric oxide through the cardiopulmonary bypass, and when ventilation was resumed, we gave it through the ventilator. What we found was that there was a statistical decrease in acute kidney injury in the treatment group, the patients that received nitric oxide. From 63% was the control group, the incidence of AKI, to 50% in the treatment group.
And it was statistically significant?
With a p0.04.
Now, in terms of, this is a fairly simple approach, correct?
Actually, it's not so simple approach. There are a lot of work to do because we need to administration of nitric oxide when the patient was on the cardiopulmonary bypass, and after the patient went off the bypass, we need to switch the nitric oxide through the ventilator, and it is the nitric oxide was given for up to 24 hours, so it's like kind of intense monitor of nitric oxide delivery and also the methemoglobin level in the plasma.
So is this clinically significant enough to the point where you think this needs to be studied further?
I think this is a great proof of concept that we showed that there is a decrease in acute kidney injury. The next step now is going to be a large multi-center clinical trial with probably 10 centers in China where we can enroll 2,000 patients and really look for number of patients that we can prevent, for example, renal replacement therapy or mortality.
What was the age of the patients who you were studying?
Much younger. For this 217 patients, the average age was 48 years old.
So these are patients that you really want to do as much as you can to prevent serious injuries because they're still fairly young and they're going to have a long expected life expectancy.
That's right. Because the incidence of the chance of they are going to subject to multiple valve replacement are really high in this group, the younger group. So we enroll patients if they are older than 18 years old, we will enroll in our study. But the average age is 48 years old.
Well, terrific. Congratulations, first off, for this particular work, and thank you very much for spending some time. And we have a variety of reporting, if you can imagine, for CardioSource World News. Look online and in the December issue of CSWN, where I'm Executive Editor Rick McGuire.